So now what we're going to do is we're going to talk about treatments. Well, how do we treat acute or chronic plantar fasciitis? So the first line of defense when we talk about plantar fasciitis is controlling the mechanics of the foot. What we want to do is we talked about the stretch, how that fascial band stretches, the arch collapses a little bit, and it puts strain on that fascial band. What we want to do is we want to control the strain or the stretch of the fascial band. And the most common way we control strain or stretch of the fascial band is putting you in some type of insert or an orthotic. And what the orthotic does is maintains the arch of the foot so the foot does not collapse as much, so it doesn't take as much stress or strain on the fascial band. And if we can take away that pull or strain on the fascial band, it'll take away some of the pain that is associated with plantar fasciitis. So a custom orthotic is the most common way we treat plantar fasciitis. You want to use something that has some rigidity to it. It's not too flexible because you don't want this to collapse when you're walking. As you can see, I really can't bend this orthotic. And if you don't bend the orthotic that much, that's we call a semi-rigid device that will actually control the heel, because we have a deep heel cup, and control the stretch of the fascial band so it doesn't stretch as much. And if we take away that strain, it won't pull and cause pain and irritation. The second line of defense that we use when we treat plantar fasciitis is something called a night splint. A lot of people complain of pain when they get out of bed first thing in the morning. Is the most common symptom associated with plantar fasciitis. We call it post-static dyskinesia because you have pain when you get out of bed first thing in the morning. So to alleviate that, we use something called a night splint, which is used to provide a prolonged stretch, stretching out the Achilles tendon and also stretching out the fascial band. And if you can stretch those two tendons, we can take away some of that stress when you step down. So the idea is that if you're tight in the plantar fascial band, and if we use the night splint to stretch you out, and we stretch those fibers and pull them, it'll take away that pain when you get out of bed first thing in the morning, or when you're sitting in a chair and you get up from that chair and you develop that you have that pain. This will take that away and alleviate those symptoms. Some other treatments that we use in conjunction with everything we talked about, such as orthotics and a night splint, is physical therapy. Physical therapy plays a big role in treating plantar fasciitis, especially when it becomes chronic, which is greater than 6 months. We have to stretch those fibers out and work out the inflammation. And that's where a skilled therapist who's trained in treating foot and ankle pathology plays a big role in treating that. All right, today we're with Travis Robbins from Robbins Rehabilitation, Lehigh Valley's premier physical therapy group. Today, Travis is going to go over some treatments that they recommend in their therapy practice for plantar fasciitis or heel pain. Earlier on, we talked about conservative measures that we use here in our practice for treating heel pain, including injections, orthotics, night splint, and then we mentioned physical therapy. So I'm going to let Travis talk to you about what they do in their therapy practice for patients that we send them for plantar fasciitis or heel pain.
So basically the most important thing when dealing with heel pain is to address the lack of dorsiflexion. So dorsiflexion is, if I told you to bring your toes to your nose, you'd bring your foot up towards you like that. If you lack dorsiflexion, typically you're going to make compensation somewhere in your gait that will cause typically overpronation, which will cause a stretch on the plantar fascia, which is the connective tissue that kind of supports the arch. So if you don't get normal dorsiflexion, your foot's going to get it from somewhere else, and will typically cheat by overpronating. If we achieve normal dorsiflexion, work on basically making sure that the intrinsic muscles of the feet, the muscles that kind of support the arch and hold the arch up, are good and strong, normal range of motion, normal nerve tension. Sometimes there's a nerve component to it that we have to address. If the nerve is tight, then we have to mobilize that. And basically making sure that you look all the way up the chain also. If there's compensations that are being made from that lack of dorsiflexion at the knee, the hip, the lumbar spine, if you don't address those, then you're kind of missing the boat and you don't get complete recovery of the symptoms, which is why there's not a lot of success typically with conservative treatment of plantar fasciitis unless you're going to a podiatrist that really knows what they're doing and a physical therapist that really knows what they're doing.